Hi students, today see about role of physiotherapist in the industrial sector. Role of physiotherapist in the industrial sector. Today's menu, that is a worker care spectrum. A 32 years old male comes to OPD with the complaints of low back pain. His chief complaints of pain in the lower back, unable to sit for longer duration. Bending forward, this increases the symptoms. Then he meet a consultant and diagnosed with the disc disease. He advised for 10 days of rest. Plan for management. Next, a 10 days of rest. What are the problems faced by patient? First, what are the problems to the management company? What is your main role here? Then, introduction. Industrial physical therapy is field of specialization. First point. Next is since it is new, most programs and the designs are based on individual experience. Less information available in the market literature. Since by last 20 years of the growing number of physios are interested in the providing services that help to reach goal of increasing productivity, returning the injured employee to work quickly and safely, managing healthcare costs through prevention program. Physios plays major role in the company by control of cost and reducing the loss of work time. Worker care spectrum. In worker care spectrum is a medical community receives the patient once injury has occurred. Acute care through the hospital or clinic traditionally has accepted for the first point of entry. The physical therapy treatment is identified as the appropriate rehab is through outpatient or inpatient setup. In this diagram, I wish to come to this. Next point is the medical community job is narrow. After injury, focusing post-injury rehabilitation. Rehabilitation is raised to its highest capability and expressed in the terms understood in medical community. Terms include like range of motion, muscle power, muscle endurance, flexibility, and kinesthetic awareness. These terms are also understood by the provider of the service, not necessarily by the recipient. Medical community fills the need of the patient care in acute injury. There is a gap in the system of acute treatment period and the point when the patient is returning the productivity employment. This gap is now receiving the considerable attention. Injured worker, trauma injured worker leads to treatment acute care hospital or clinic. Next goes to treatment rehab IP or OP center. Next goes to productivity return to work. Next as the medical community was concentrated to fulfill the gap that devised functional assessment, job analysis, work hardening, exit assessment are the part of the industrial therapy. Injured worker gap. This gap leads to education evaluation, that is a functional assessment. Next evaluation leads to job analysis at the site of task. Next leads to treatment work hardening. Next evaluation of exit assessment. Prevention. Variety of prevention method of the which are introduced in physiotherapist include pre-employment screening, job analysis, biomechanics, overuse syndrome prevention. Therapist should be prevention category, pre-employment screening, then evaluation of job analysis on site of task, education, biomechanics, back school, evaluation of overuse prevention syndrome.